Hello students, I am Dr. Nidhi Gupta, faculty at the Center for Population Health and Development, School of Development Studies at Tata Institute of Social Sciences, Mumbai. I welcome you to the module on Health Management Information Systems for Improving Population Health, which is a part of Population and Health paper. The main objective of this module is to familiarize you about the Health Management Information System, that is HMIS, its need and application. The module will also highlight the important concepts and components of HMIS and the steps involved in creating a responsive HMIS at country and regional levels. Towards the end, we will discuss the challenges in implementation of HMIS in developing countries. As per the World Health Organization, a well-functioning HMIS is the one that ensures the production, analysis, dissemination, and the use of reliable and timely information on health determinants, health system performance, and health status. Now we need to understand why is there a need for health information system. A good management is a prerequisite for increasing the efficiency of health services. Improved health information system is clearly linked to good management. Information is crucial at all management levels of the health services from periphery to the center. It is required by policymakers, managers, healthcare providers, and community health workers. Health planners and decision makers need different kinds of information. Now let us look at the different kinds of information they require. Information about health determinants, which means socio-economic, environmental, behavioral, and genetic factors, as well as the contextual environmental factors within which the health system exists. Information about the inputs to the health system and related processes, including the policy and organization, the health infrastructure, facilities and equipments, costs, human and financial resources. Information is also required by policymakers about the performance or the output of the health system, such as the availability, accessibility, quality and use of health information and services, responsiveness of the health system to users' needs, and financial risk protection. Health outcomes are another important information in the form of mortality, morbidity, disease outbreaks, health status, disability, and well-being. Health inequalities information is equally important in terms of determinants, coverage of the use of services, and health outcomes. It also includes key stratifiers such as sex, socioeconomic status, ethnic groups, geographical locations, etc. Now let us look at some of the important definitions in order to understand health management information systems. What is a system? A system is a collection of components that work together to achieve a common objective. And what is a health system? A health system includes all the activities whose primary purpose is to promote, restore, or maintain health. And information is any meaningful information or data or facts. Then information system means a system that provides specific information support to the decision makers in decision-making process at each level of an organization. Hence, health information system may be termed as a set of components and procedures organized with the objective of generating information which will improve healthcare management decisions at all the levels of the health system. The ultimate objective of health management information system is not just to gain information but also to improve action. Now let us look at the various terminologies used for HMIS. Different countries use different terminologies to represent HMIS. Healthcare information technology is another term that is used by various countries, which clearly signifies the technology bent. Health information system or healthcare information technology may be interpreted as the umbrella term, which is a system or information system connotation. Informatics is another commonly used term among European researchers, and health informatics or clinical informatics generally refers to application of data methods in medicine, healthcare services, and clinical practice. Some authors also use the term health informatics and medical informatics as well as e-health or electronic health. Now let us look at the various components of HMIS. An understanding of the adaptive but integrated HMIS begins with differentiating among its 5 major components and their interrelationships. These components are as follows: data or information or knowledge component, hardware or software and the network component, the process, task or the system component, integration component, the user, administration or the management component. These are the 5 important components whose interrelationships are important to be understood to have an integrated HMIS. Now let us look at the steps involved in developing a responsive health management information system. Step 1. Step 1 is identifying information needs and feasible indicators. Step 2. Defining the data sources and developing data collection instruments for each of the indicators selected. Step 3. Developing a data transmission and processing system. Step 4. Ensuring use of information generation. And step 5 is planning for health management information system resources. Step 6 is developing a set of organizational rules for HMIS. Now let us look at each of the steps in detail with some examples. Identifying information needs and feasible indicators, which is the step 1. Now it should include identifying information needs for, say, follow-up of pregnant women in a primary level, identifying indicators to ensure efficient drug management in a referral hospital. It may also include identifying indicators to ensure efficient information, education, and communication in the community. Identifying the indicators to monitor the quality of supervision by the district management team. Step 2 includes defining data sources and developing data collection instruments for each of the indicators selected. For example, you may develop an appropriate record form for follow-up. For example, follow-up of pregnant women for antenatal care utilization. Develop a monthly reporting form for activities performed at a primary level. Defining the data sources for situational analysis at the district level. And develop data sources for monitoring the quality of teaching in a medical college. Step 3. Step 3 is developing a data transmission and processing system, which may include defining and structuring the information flow on, say, pregnant women between the traditional birth attendants and the midwives in a healthcare center. Ensure that monthly report forms for health centers are entered in the district computer in a timely and accurate manner. Develop a mechanism for reporting of research done in the research center. Step 4. Ensuring use of information generated. This includes developing user-friendly feedback formats for regional managers on the utilization of inpatient services like institutional deliveries in the region, training health auxiliaries in the follow-up procedures, for example, pregnancy-induced hypertension cases using a standard record form, developing a curriculum for the undergraduates and postgraduate students depending upon the need in the country. It also may include ensuring research on the priority health issues for the country. Step 5. Planning for health management information system resources, like creating positions for computer operators or data entry operators in cases where district level data processing is computerized. Submitting recurrent cost budgets based on the proposed data collection procedures. Step 6. Developing a set of organizational rules for HMIS. This is the most important step as it becomes a guiding principle for all the manpower as well as the processes in the HMIS. This includes developing case definitions, changing the job description of doctors in cases where health information system involves their active participation in data collection, developing an instruction manual for computer operators and other staff involved in HMIS components. Now let us look at the information process. The information process includes data collection at the grassroots level, and this data is fed in at the computers either at the block or the district level, and this data is transmitted to the higher levels where the data is processed and analyzed and the output reports are generated, and this information is used for planning and management by decision makers like policy makers and program managers. And all of this is guided by organizational rules, and all of this can happen only when there is adequate allocation of resources. Now let us see what are the ways to enhance the use of information in decision making. Clearly defining the characteristics of data. Once you clearly define the characteristics of data, characteristics of problems and the decisions that are required also gets clearly defined. Organizational and structural characteristics also need to be defined. Minimizing the cultural differences between the data people and the action people. Data people are the people of the system, the manpower of HMIS, whereas action people is the community. Improving the communication between the two is another vital component to enhance the use of information in decision making. Now let us look at a few subsystems of HMIS. World Health Organization proposes to categorize the health management information system under 5 interrelated subsystems. The first one is epidemiological surveillance, which includes notifiable infectious diseases, environmental conditions, and risk factors. The second subsystem is the routine service reporting. The third subsystem is special program reporting system, which includes reporting for tuberculosis and leprosy control, maternal and child health, and school health. The fourth subsystem is administrative system, where reporting about healthcare financing, health personnel, and logistic systems is undertaken. The last one is the vital registration system, which includes information about the births, deaths, and migratory movements. Now let us look at some of the elements of HMIS in detail. Communication within HMIS teams is a vital component. The communication process includes feedback process and communication products like time comparison, geographic comparison, comparison of actual performance versus mean performance, and comparison of actual versus the planned performances. A framework for defining information needs and indicators is another vital component. It includes performing a functional analysis at each management level of the health service system, identifying information needs and selecting feasible indicators for example, patient or client management, health unit management, or health system management. Now let us look at types of routine data collection methods. Health unit data collection is one component. Community data collection is another important component. It helps us to monitor activities performed in the community by the health unit staff or by the community health workers. It also enables to obtain more representative data on health status and living environment of the communities served, including data on births and deaths in the community, agricultural and meteorological data, data on education, etc. To assist in planning for health services that are more accessible to the community. And another vital component of data collection method is the civil registration system. Now let us look at data collection instruments. Data collection instruments for patient management can be classified in two different subheads, curative and preventive. For curative, the data collection instrument could be medical records, laboratory forms, referral forms, etc. And for data on preventive information can be obtained from growth cards, maternal and child health cards, school health cards, or family registration records. Some of the other data collection instruments could be home-based records like immunization cards, growth monitoring cards, etc. Health worker-based records like the pregnancy or the birth card, death report, child record, women's registers, women work form, etc. Supervisors roster can be another instrument for data collection. District-based records may include family enrollment forms, birth registers, death registers, health workers' reports, and their supervisors' reports. Donor-based reports of health project outputs and population health status can be another important instrument for data collection. Now let us look at designing and implementation of routine data collection systems. These include answering questions like how many and what type of data collection instruments will be needed to respond adequately to the defined information needs. Are the existing instrument adequate or do they need to be modified? If new instruments are needed, how will they be developed? How will the new data collection instruments be introduced to the care providers in charge for data collection? And addressing various other issues of relevance, feasibility, burden, layout, and clarity. Some of the important elements of health information management system include organizational rules, as we already discussed, but what should be the organizational rules for? There should be specific organizational rules for data collection standards, case definitions, data transmission, flow of information, confidentiality, training standards, software design, procurement and distribution, and quality assurance. The data transmission may occur as vertical or horizontal levels. Usually it occurs at both the levels. And it is important to maintain data quality. To understand what data quality is, it is the degree to which the data or statistics measures what was intended to be measured when the data was collected by the system and it was designed. Mechanisms to address inappropriate data collection, failure to report data, unintentional recording or reporting of inaccurate data, intentional recording or reporting of false data, and errors in processing the data like editing, coding, data entry, and tabulation. These are some of the factors that should be kept in mind to improve the data quality. Now, let us take an example of mother and child tracking system in India. The mother and child tracking system is a beneficiary-specific database for maternal and child health services delivered through the Indian public health system. It was launched in the year 2009 as a part of global trend towards harnessing e-health innovations in improving service delivery, and also because India's existing HMIS was not meeting the service delivery needs of the frontline health workers. MCTS, or the Mother and Child Tracking System, has clearly defined objectives, scopes, and implementation, as well as timelines and milestones which have measurable outcomes and service levels. The MCTS is designed to capture and track all pregnant women from conception up to 42 days postpartum and all newborn children up to the age of 5 years. Its objectives are to ensure that all pregnant women receive their full antenatal care and postnatal care services at the due times. Institutional deliveries for pregnant women, particularly for high-risk mothers, are encouraged, and all children receive the full immunization schedule at the due times. Now let us look at the data flow and data entry for the MCTS system. The data from the beneficiaries and the service data is collected at the village level by the frontline health workers, and these frontline health workers are ASHAs and ANMs, and they feed in data in their registers. This is transferred to the PHC level for entry in the MCTS portal by data entry operators. This is then fed into the district and state level where the data gets consolidated, and a consolidated summary report at the national level is generated for MCTS. All health facilities from the state to the most peripheral health subcenters, that is HSCs, are mapped in the portal and also maps the frontline health workers to specific HSCs. The data enables the MCTS to generate the work plans for frontline health workers, detailing their forthcoming service delivery needs such as antenatal checkups or immunization sessions on pre-beneficiary basis. Supervisory officials can also generate reports from the MCTS web portals that indicate MCTS performance, like beneficiary registration rates or service delivery performance, for example, percentage of children fully immunized. Now let us look at the important factors that contribute to the success of MCTS. The success of MCTS as a data system relies heavily on the processes and the practices at the village and the HSC level, because these are the points from where the data are collected in the registers and which are fed in the HMIS. The field level data collection, consolidation, and transfer activities ultimately determine the MCTS data quality. However, there are important challenges that need to be overcome, like there are non-standardized data collection tools and hand-drawn formats for data collection, linguistic challenges like data entry in the portal is in English whereas the data collection is in regional languages. There is inadequate training of FHWs on data formats. There are errors in data entry, both unintentional and intentional, due to the targets set for FHWs. An important challenge is irregular electricity supply, inconsistent internet connectivity, and the slow speed of MCTS web portals are some of the challenges faced at the block level facilities where the data is fed at the portal. Now let us look at the strategies to overcome these challenges. If we have the registers and formats which are standardized to meet the needs of the MCTS portal as well as the service delivery needs of FHWs, then it can improve the quality of the data generated by HMIS. Designing clearly defined standardized data processes and guidelines which are needed to be designed for staff at the most peripheral levels of the health system. These guidelines should be clearly laid out with the plan for data collection, consolidation, and transfer to the data entry point with stipulated timelines and clear organizational rules. In addition to this, strengthening the infrastructure, that is, the internet connectivity and the speed of internet will be an important factor to improve HMIS. In addition to this, adequate training of human resource is vital to the success of HMIS. To conclude, we can say that HMIS is changing the way information is gathered, processed, and used for decision making, which implies changing the way an organization operates. It is enabling the policymakers as well as the program implementers in better monitoring of health interventions to improve health outcomes, as well as enabling them to take evidence-based decision making. Though there are many challenges in implementing HMIS in developing countries like India, the situation is improving with experience, time, and understanding about the importance of allocating resources to HMIS. Thank you.